Hello to all the viewers. The INISS May 2025 BM Neurology entrance results have been announced just a while back, and I've got rank one for the common merit list and rank two for the AIDS merit list. Dr. Madhu Hasini, wonderful rank, and hearty congratulations.
Good evening, sir. Thank you so much, sir.
So, Madhu, what are you feeling now? Just a while back, you've heard this rank of one. You have seen this rank of one adjacent to your roll number, and what do you feel?
Sir, this is actually my first rank one, sir. I didn't get any first rank or single digit ranks in my all the exams.
Great.
Sir, I'm very happy, but it is, sir, actually, I didn't expect this rank, sir.
Okay.
I'm
But
very
I'm
happy.
sure you really deserve this because you have got awesome ranks both in the common merit list as well as the AIDS merit list. I'm sure that the entire country is wanting to listen from you on your preparation, on the strategies that you had, so that the future INI aspirants can really benefit from this. Okay. So, Dr. Madhu, I'm sure that the insights that you're going to give to the viewers will definitely help them in planning properly for the subsequent INIs as well. Because even a medicine resident of first year, second year, final year, they all will be listening to you. So, Madhu, to start off with, can you just tell the viewers a bit about yourself? Where are you from? From which college did you do your MBBS, and then post graduation from which college?
Sir, I'm from Andhra Pradesh. Ongole is my hometown, sir. And
Okay.
I did my undergraduation in from Guntur Medical College, Andhra Pradesh only. And
Okay.
I did my post graduation from JNMCH, Aligarh Muslim University. And
Okay.
sir, now I'm not working anywhere, sir. I am preparing only since my exams in
Right.
January.
So, Madhu has been preparing very seriously for the INI. Even for the previous attempt, she had got a decent rank. At that time, also, she was preparing with us, and now she has got such a wonderful rank of one as well. Now, Madhu, taking you through, taking your journey as a role model for the subsequent INI aspirants. Let me just tell you that you have improved significantly because recently there was a NEET SS exam, and from that NEET SS rank of 700, in a very short span of time, you have got rank one. So that mindset is really inspiring because I've heard of comebacks, but to get a rank of 700 and in a very short span, I think you should be really proud of the effort that you have put in over the last couple of months.
Thank you, sir.
Right. And again, coming to your preparation strategies. Now, you had been a student of DocTutorials, and when you prepare for an exam like INI, which is very competitive, and a subject like neurology is also very vast. So often it is difficult to finish the entire topic of neurology, and you will have to do some smart study as well, which is why in the DocTutorials app, along with the main videos, we have got revision videos, LI test and discussion videos, Harrison's based tables and flowchart videos, the recall videos, and I'm sure that you have gone through these. But first, let me ask you about the QRP or the quick revision videos in the DocTutorials app. When you prepared for the INI, how did the quick revision videos help you in your preparation, especially for covering a vast subject like neurology in a short span of time?
Sir, I have my main preparation basis was QRP only, sir. Because in my post graduation only, I have read the main topics of neurology. So
Okay.
sir, it was in the QRP session. I felt like most of the topics are covered. All the most important points have been covered in those topics. And sir, I am not a person who would like to read the book continuously. So, sir, I used to do the MCQ questions, and whenever I go wrong, sir, I go to the QRP discussion and sorry, QRP videos, and I listen to them, and I noted the points where I have gone wrong, and I have corrected them, sir. In that way only, I have prepared, sir.
Okay.
Sir.
And how many times would you would have gone through these QRP videos? Did it require multiple revisions?
Sir, on a continuous basis, I have I have done QRPs for 2 times, and other than that, whenever I do an MCQ wrong, and I go to that topic and I will listen to that topic, sir.
Okay. So basically, 2 rounds of listening to QRP. Then,
Yes.
whenever you did a question wrong from a grand test or QBank, you would retrospectively come back to the revision videos as well. I think that is a very important strategy as well. Now, how did you like the pattern of QRP? Like, as I told you a while back, neurology is vast. So, did the concise way of presentation help you in understanding a lot of concepts in a short span of time, especially for topics like neuro-ophthalmology, neuro-otology, which are relatively vast but are summarized in the QRP videos?
Yes, sir. I think, sir, for any topic, for one topic, if we study from a textbook or from any other source, sir, it will take a lot of time, and after that, we remember only a very less amount of the topic. Sir, rather than that, the QRP videos are very concise, and they have all the important points in it, sir. It gives, and also it gives the base of the topic. I think, sir, it provides the base of the topic, and after we have a good basic knowledge, then sir, we can bombard with any of the extra matter that we study from here and there, sir. I think the basics are important, so I used to watch the QRPs relentlessly, sir.
And then when it comes to INI, there is usually a set pattern. Certain important topics, they do get repeated. So it is very important to go through the recall videos to get an idea of the previous year questions and previous year topics. In the DocTutorials app, we have done elaborate discussions of the previous year questions. And for every recall video that I have done, not only that question, but certain other important points related to that topic also I have discussed. So, Dr. Madhu, did you go through these recall videos of the previous year questions, and how did that help you?
Yes, sir. I have done all the. I have watched all the recall sessions, sir. And
Okay.
from the recall session, sir, it was very nice, sir, that you explained not just that MCQ, but all the related points to it. That was very helpful. It is not like, sir, we watch the recall video and we have to go to that topic again and read the related matter. Sir, it was explained then and there itself in the video. Sir, so, and the topics, I usually note the topics, and I read them. I used to read them, sir.
Okay. Now, when you watch these recall videos, because there are many recall videos that I have done, I think right from the year 2021. So, this is basically a student's query. What do you do when you watch these recall videos? You just watch it, or you write the notes, or you mark it in your say textbook, or what was your method of doing these recall videos?
Sir, in the recall videos, it was more like, sir, if I already know the topic and I have answered the MCQ correctly, I see, sir, first if I can answer the MCQ or not. If I
Okay.
would have answered it and I thought it was an easy question, I just mark that topic and think that is important. And if I didn't answer the question, then I have a separate notes for the topics that
Okay.
sir, that have not been included in the main notes, sir. So I
Right.
have a second notes, and in that notes I have added all the extra questions that I
Right.
don't know, and I used to study that later, sir.
Got it. And what about the Elite test and discussion videos? Were you satisfied with the Elite TND videos as well?
Yes, sir. I think the QRPs are the basics that everyone should have completed. And after the basics, sir, it is like after the basics, you are going more and more into the subject. Allied discussion. I felt allied discussions like that, sir. But it is very important to have that base to start the allied discussion itself, because, sir, I have started watching allied discussions earlier, and I have got confused at in some topics. Then I went to the basics, and I have completed my basics. Covered my basics a few times, and then I watched the allied discussion, and then I understood some points of what sir you were saying, and then I got. I thought it is this subject is very nice. I thought I fell in love with the subject with the allied discussions, sir, actually.
I think that is very important. What I believe is in the DocTutorials app, what I felt that if I was a student, I would like is the structuring of the program. Because, see, we are all busy in life. Some of us are practicing. For some of us, we would like to have a retrospective method of learning from MCQ to the notes. So in the DocTutorials, I think we have got main videos, then the shorter version of the videos, the LI test and discussion, Harrison tables and flowchart, so that depending on how much time you have in hand and your method, you can choose, okay, this is how I want to use the app. So that is something that, DocTutorials app would have actually helped you as well, Dr. Madhu. Right. And coming to the question practice. Now, for any competitive entrance examination, MCQ practice is very, very important. So just take us through the Q bank of DocTutorials. How useful were the questions in the DocTutorials Q bank in your preparation and to your journey to rank 1?
Sir, my main mode of preparation was from the MCQs only. It was not reading notes. I think, sir, reading the notes entirely, it doesn't go into my brain. So I usually, sir, do MCQs. I choose a topic. I do MCQs. I see at what areas I am good and what areas I am weak. Then I go back and just I read those areas where I am weak, sir. And then I go to next topic. So I think in this manner, we have to read less and we can retain it better, sir. Rather than reading pages and pages notes, I think, sir, this is better, sir. So I use this strategy. And I completed the Q bank, sir.
Okay. So how were the questions in the DocTutorials Q bank? Did you find the quality of questions satisfactory?
Yes, sir. For almost all the topics it is like, sir, almost all the my notes topics have been covered in the Q bank. All the base topics have already been covered, and but after, sir, I think they are one level higher, and that is usually necessary for sir more and more information. I used to sir. The very important thing is. After the MCQ, there is in the bottom line, there is a reference and the page number is given for Bradley and Harrison. That is very nice thing. So then I used to go to the book and I check the any other important thing in that page. If it is there, any table is there, and I used to screenshot the table and read, sir. That is very useful thing, sir.
So basically what you're telling is that for every question that you were doing, you would see the page number, just visit that page as well. And so that you will also get that confidence. Okay, I have done this much from Bradley, or I've done this from Harrison, or maybe something that you have read previously. But when you see the question, you might feel that, okay, I missed out on that point. And then, you can highlight that point as well. Am I right?
Yes, sir. For every module, sir, almost 40 to 50% of questions are basic level questions we can answer, sir. Then there are higher level questions. For every that kind of level question, I used to go back to the reference, sir.
Got it. And what percentage of the DocTutorials Q bank did you solve for your preparation?
Sir, I have completed the Q bank for one time, sir, and later on I reviewed it for one time, sir.
Right. So it's almost like 2 times you have gone through the Q bank. You've gone through the Q bank once.
Incorrect answers, I have reviewed it.
Right. So that means, you have put in genuine effort. So were you preparing exclusively for INI, or you were working as well?
Sir, I have prepared exclusively. Sir, NEET has happened just 1 month before it, sir. In the January, my session has been completed. I have completed my MD in the January 2025. Then from January and February, I used to study for NEET only, sir. Then later on, I prepare for INISS completely, sir, exclusively.
Right.
From March onward.
You put in genuine effort for this. Otherwise, to complete the entire Q bank and to review is difficult. But you have done this means you were so passionate. Maybe after NEET you wanted INI. It's as if you prepared like that, so that you finished the entire Q bank, leaving no stones unturned, all the recall videos done, QRP, everything done 2-3 times. So much of effort has gone to it. Now coming to the grand test in DocTutorials, obviously to assess your preparation solidly on whether you are going in the right direction, you need to assess your GT performance. So how were the grand test in the DocTutorials, and how useful were they in your preparation?
Sir, in the grand test, sir, I used to give the live grand test live only,
Okay.
and used to assess my ranks and compare. And after that, sir, I am not into reading notes and watching long duration videos. So I used to do, sir, many grand tests every day. I used to do the grand test in the morning and review it until evening, and later on, sir, review the incorrect answer topics, and I used to read in that time, sir. So I have done grand tests almost every day for month or month and a half, sir.
And when you look at the progress of your ranks over the grand test, were you performing well in those grand tests? How was the
Uh,
progress?
yes, sir. I gave only, sir, three live. Sir, at the time, three grand tests were live, sir. In the
Okay.
live grand test, my first rank was 3, sir, and second rank was around 13, sir, and third grand test was also my rank was around 3 or something like
Okay.
that, sir. It
So
is
how many grand tests happened in the DocTutorials app?
Sir, in the doctorals app, previous year grant tests, so many were there. Around 56 grant tests were there, sir. And I have given them almost all of them. I have
Which means
completed, sir.
almost all of the grand tests in the app you have given, correct?
Yes, sir. Every day I used to give a grant test, so I have completed them, sir.
So which means the strike rate is like you have done 100% of QBank, 100% of the grand test, and also the QRP videos you have gone through it 2 to 3 times. Again, goes to show the effort that has gone into your preparation. Now that is great. Something that all of us should take inspiration, especially the future aspirants, on the time she has devoted for preparation. Because if you are determined to get something, you will have to put good amount of effort for that. Now, as we all know, for the INI, it's a two-stage exam. The second stage is the interview round, and I've been conducting mock interviews for the last, several years for the INI exams, and so this time also we had conducted the mock interviews. Dr. Mathu, did you go through the mock interview videos of the sessions that I've already uploaded in the app, including this one? So did you go through my mock interview videos, and how useful were those mock interview videos for your second stage of preparation?
And after the first stage, I thought second stage was complete out of my hands. That was my perception, sir, because I am very shy and I get intimidated very easily. So I thought that this was out of my hands. And just, sir, in the mock interviews, what I used to watch the mock interviews, sir, and I thought I have just remembered the mock interview sessions, and just I went and sat there in the interview. I was so tense that I couldn't even read for the interviews, sir, other than the mock interviews. You have
Mock
given, sir,
interview videos, you had watched it completely,
yes, sir.
correct?
I have watched the mock interview sessions, all of those, and the screenshots that you have shared, sir. Those screenshots I have reviewed all them at once, but I was not very sure for the interview round, sir. It is all what you have told in the mock interview sessions only, sir.
So the videos that you watched in the actual interview that happened, did that actually help in the actual interview, the questions that were discussed?
Yes, sir, both questions were discussed in the mock interview. So, sir, I was very happy after the interview. Sir, very rather than happy, I was very relieved after the
Okay.
interview, sir.
Which means
Both questions.
two questions that you got for the actual
Yes, sir.
interview
Yes, sir.
were the ones that were discussed in the
That
mock
were,
interview.
that were discussed in the mock interview, sir. Yes.
Right, got it, got it. So I think that is great, because every year I conduct these mock interview sessions, even for other specialties, endo, cardio, nephro, gastro, we oncology, we hematology. So we conduct all these mock interview sessions, and I think these interview sessions are a must watch, because Dr. Madhu, you would also agree with me. Preparation for round two is entirely different from round one, right? Because many students think that, okay, we are done with MCQ, we'll once again revise those MCQ points and go to the interview. I think you are the best person to tell the viewers. Is the
Sir,
preparation for
sir, I
which
have
one?
closed those books completely before the interview, sir. I have closed those books entirely. Sir, I just went through the screenshots, and just, sir, I
Screenshots
thought
means
that
the ones that I have shared in the group.
yes, sir. Yes, sir. The question that you have shared in the group, sir.
Yeah.
I would like to frame the interview. Just I would keep my phone with me, and I would sit, and I imagine how I could have answered that question if it was asked for me, sir. That I did, sir. I kept the books closed, sir.
Right. That's good, because I think, as you said early, even the same point I've told in the mock interview as well. Even if you are a reserved person, on the day of the interview, your body language should be good and you should be confident while answering. That is very important. You might be an introvert, but when it comes to the interview round, you will have to speak out. And I think those mock interviews might have actually helped you,
Yes,
even because you had attended the mock interview even before as well, the previous session as well.
yes,
So at
sir.
least you got to know, even when you, because see, when you go to that interview, you exactly know what is the pattern of question that they're going to ask you, approximately what time will they ask you. And also I told you that, sometimes there can be small delays. So all those
Yes,
is very important, right? When you go to this interview round. Right, right. So, so awesome to talk with you, Dr. Madhu, because to get a rank one, and you said this is the first time in your life that you're getting rank one, and what a time to do it. And now you've got a chance with such awesome ranks to select any college that you want, any top college for neurology in the country, Central Institutes. So that is great, and hearty congratulations on behalf of entire team of DocTutorials for your amazing success. Thank you so
thank you.
much for joining,
Thank
Dr. Madhu.
you.
Thank you.